When I was here for family medicine, I spent 6 months with one preceptor and 6 months with another preceptor doing longitudinal family medicine, but also comprehensive primary care. So that included doing shifts in the emergency department, about 1 to 2 shifts a week. On top of that, I would do some hospitalist inpatient work for the patients in our practice every morning, going to round on patients, and then on top of that, some full weeks of hospitalists just to gain more exposure to that. And mixed in there were some electives in anesthesia, so I really got a good exposure and variety there. I found all of the family physicians here to be extremely welcoming. Even within the practices that I was working in, they would sometimes pull me away to come see interesting cases or help out with procedures. They were very eager to teach, and I think more importantly was the mentorship piece. Like, oftentimes they were happy to discuss and debrief cases, talk about how to set up a practice, and advice just for practice and setting up your work-life balance in general, which I liked. Same thing with the specialists. I found they were very eager to have me in to help out with things for procedures-wise and to teach around certain cases. They were very welcoming on the phone when I would ask questions or give a consult to them. And I felt like I learned a lot from them as well. So it was a really positive experience. I found that Orillia had a nice mix in terms of patient population as well. There is some exposure to Indigenous health. There's also inner city medicine that you're practicing here, even though it's a small town. You get exposures to addiction care, along with just bread and butter family medicine, well children, pregnant, healthy women. So I found that there was a good mix of cases, both challenging and more classic as well. I think for soldiers specifically, it's the whole vibe here is very welcoming. People are happy and they tend to work together. I find there's a lot of teamwork, not just between doctors, but interprofessionally. So doctors and nurses working together, different specialists working together. And I really appreciated that. It seemed like a lot of the physicians and nurses and other allied health were friends outside of work as well. You know, they do fun things like go golfing together or just get to know each other on a more personal level. And I think that contributes to being happier at work and to better patient care. And then in terms of the staff, they're very, very friendly, very eager to teach. Being one of the few learners here, there was a lot of hands-on opportunities to manage difficult cases, get a lot of procedures in, and it felt like you got the pick of the list in terms of what you wanted to do. Amongst all the variety of the different specialties that I practiced through, like emerge and anesthesia, that whole combination made it a really enjoyable experience to be here and offers a unique experience for family doctors to have a broader scope of care, which I think is quite exciting. Orillia itself was a great community. I always wanted to know what it'd be like to sort of practice in an area that was more like cottage country. So I really enjoyed the lakes when I was here. I paddleboarded a lot, often after work. In the wintertime, I had opportunities to go skiing at Mount St. Louis, which was only a 25-minute drive away. So it was quite nice to have better access to the outdoors. I'm from the GTA, so I really enjoyed that aspect. So I finished family medicine and I'm doing my extra year in anesthesia. So I wanted to come back to Orillia because the group here is phenomenal. Again, great mentorship, great bread and butter family medicine care, great bread and butter anesthesia care. So I wanted to come back and just get more experience in that area. And a lot of residents who come here often end up staying on to work here. So I'm excited to explore future employment opportunities as well.